Circle of Hope, presented by MUSC.
Every 2 seconds, someone in the United States requires blood. For people fighting sickle cell disease, the most common genetic blood disorder in the country, affecting approximately 100,000 people, primarily of African descent, regular transfusions are crucial for managing painful and life-threatening symptoms. But there is often a shortage of blood. And I'm excited to welcome two guests in our studio who are making a significant impact in raising awareness about sickle cell disease and how we can support patients and their families. Joining us today are Kiosha Pinckney, who was diagnosed with sickle cell disease actually before she was born and has defied the odds and is thriving and leading the charge in awareness and making sure that people understand the importance of blood donations. And Dr. Jennifer Jurasik, who is a distinguished pediatric hematologist and oncologist and is leading clinical research and interest focused on gene therapy for inherited blood disorders and also treatments for sickle cell disease, and serves as an investigator on several clinical trials designed to enhance patient outcomes and diversity in the community. Thank you both so much for being here. There's so much to talk about when I even read your bios, both of you leading the charge when it comes to giving out information about sickle cell disease. Kiosha, let's start with you first of all. You have managed sickle cell disease, again, diagnosed before birth. What do you want people to know about your diagnosis and how you live every day with this disorder?
I want people to know that it's not a stopper for you. You can keep going, you can live life to the fullest, you can go to school, you can have a career, you can have a life. You can do anything you put your mind to doing.
But it is important that people understand that you have to have blood transfusions, yes, and you want people to understand the importance of making sure that blood is on the shelf when they need it.
Yes, ma'am. It's valuable. It's important that we have it there. It helps me. It helps millions of people.
Can you describe what a crisis is for you with sickle cell disease?
Sure. My crisis is basically end up in my arms, legs, stomach are my main places where I have them, but it can be anywhere on the body. It's more of a chronic pain, like a stabbing, jabbing pain in your joints and muscles. You have swelling from time to time, but we get through it. I get through it. Keep pushing.
Dr. Jurasik, I see you nodding because you probably heard stories like this before. You understand what it means. Can you, as simply as possible, explain what sickle cell disease for someone who might be hearing this for the first time?
Oh gosh, yes. So sickle cell disease is caused by a single point mutation that causes the red blood cell to change shape. So normally it's a round, flexible disc, and in people with sickle cell, when they start to have a crisis, that point mutation causes the red blood cells to become sickle shaped because the hemoglobin polymerizes and forms like a stiff red blood cell, and then those cells get trapped in the blood vessels, and the tissue beyond that blockage doesn't get oxygen, and that's what causes the pain.
Which populations are most likely to be affected by sickle cell disease, Dr.
So,
Jurasik?
African Americans primarily, but also people of Mediterranean descent and some people of Hispanic descent, but primarily African Americans, and it's the most commonly inherited genetic disorder.
Kiosha, you talked about the importance of blood transfusions and that blood being on the shelf when you need it. You have even led and encourage people to be a part of blood drives.
Yes, ma'am. Every chance I get, if you can donate, please do. Please do.
Dr. Jurasik, what do you want people to understand about innovations when it comes to stem cell and research that's available right now?
Gosh, it's been amazing. Kind of in the past 2 years, we've started doing transplants with half-matched family members, and we're having really good outcomes for those in our patients who are symptomatic. And then a little over a year ago, 2 gene therapies got approved by the FDA, and those gene therapies, when they're effective, are about 94% effective in preventing the vaso-occlusive events in people who have gone through the treatment. So.
Kiosha, when we talk about the fact that this is an inherited blood disease, you know people in your own family who are also affected by sickle cell disease.
Yes, ma'am. I have a niece who's 25. She's affected with sickle cell SS. We both have type SS.
And what about your parents? Were they carriers or?
They both had the trait.
They both have the trait. And that's something that you want people to know, Dr. Drossik. It's very important that people are tested, and that's something that's relatively easy to do.
And most people in the state of South Carolina now are tested at birth. So if you're a carrier, you should know that. If you're affected with the disease, you should know that as well. So it's called newborn screening, and everybody now should know that after they're born.
And Dr. Drossik, have you noticed a significant difference in terms of people understanding this, since this is now a change in South Carolina, that this is done, this screening process is done early?
So surprisingly, there are still a lot of patients, even African American patients, who are really unaware of the inheritance patterns. So it's really important. Part of our job in our clinic is to educate families about how it's inherited, and like people like Kiosha who are willing to talk about their experience and help the public to understand how it's inherited.
Absolutely. Well, Dr. Drossik and Kiosha, thank you so much for your time. We appreciate you being a part of our 8-month campaign to make sure that people understand the importance of awareness and blood donations through the Circle of Hope campaign. Now, we also want you to know that you can participate in the big gala that's happening later in the year, in the fall. The Circle of Hope Gala is happening at the International African American Museum on Wednesday, October 1st. It's from 7 until 10 o'clock. If you'd like to find out more information about it, you can go to theamericanredcross.org. Thank you for being a part of this segment, but there is a lot more of News to It For after a quick break. Stay with us.